Hello, and welcome to the GoLIVE Health Foundation Health Equity Webinar Series. Thank you to all of the sponsors of our series. Today's episode is brought to you by your friends at Surest. We would like to remind you that the Q&A feature is available, so remember to send in your questions for our speakers throughout the discussion. And with that, I will turn it over to our moderator who joins us from Fierce Healthcare, Paige Minnemeyer.
Hi, everyone. My name is Paige Minnemeyer, and I'm a senior editor at Fierce Healthcare. I'm joined by Trevor Fast, Chief Actuary and Benefit Product Lead at Surest, Kate Brown, Center for Health Innovation Leader at Mercer US Health, and Stacy Hewler, Senior HR Director for Americas at Medtronic. We'll be taking your questions throughout this webinar, so feel free to submit them as we go. Kate, to help set the stage for our conversation, can you talk a bit more about some of the trends Mercer is seeing in the industry right now around affordability, the workforce, and employer coverage?
Yeah, thanks, Paige, and thanks everybody for having me here today. So there is a lot of new research that Mercer just released into those areas you just referenced, Paige: affordability, the workforce, employer coverage, all that good stuff. We just published a piece of research called Inside Employees' Minds, and in that we surveyed around 4,000 US workers, and this survey was conducted over the last couple of months, so it's pretty recent data. And really the intent of this research was to understand, what are employees thinking about, what are they worried about, how do they feel about their employers and their employment contracts. And the upshot is that employees are worried about a lot. The top 5 employee concerns are covering monthly expenses, being able to retire, their workload and life balance, and then their physical and mental health. So in that top concern of covering monthly expenses, nested within that is concerns around affordability of healthcare. According to the data, 68% of employees report challenges getting the healthcare that they need for themselves or for their family members. And closely related to that, providing access is another issue that people report really having a problem with. A lot of people are having a hard time getting to the doctor when their schedule permits, and also being able to take time away from work and getting access to the specialists that they need. So there's a whole bundle of issues around sort of accessibility and affordability in healthcare that's really top of mind right now for employers. Employees, although probably employers too. There's some other things in the report that I think are salient for this discussion. Mental health and burnout are also key areas of concern for employees. So among hospitality workers, 60% of them reported being exhausted on any given day. And as you can imagine, that has major implications for business. And also as HR and benefit professionals who are thinking about addressing the needs that exist within your employee population, I think it's pretty important context to recognize the scope and the depth of the mental health issues and the burnout issues that might be present within your population. And then the last thing, and this is maybe not exactly related to today's conversation, but I think that it's an important piece of context that also came out within this research, is that people are really interested and really focused on flexibility. So in this study, it popped up in relation to job design, right? People want to be able to have a hybrid work environment, to go into the office when they think it's good. They want to work the hours they want to work. So it's again, not kind of directly related to benefits, but I do think that it's a broader theme that people want that flexibility in their lives. They want to be able to flex their engagement to meet their needs. And I'd argue that that desire for flexibility also extends into their desires around health and benefit programs. So yeah, like I said, employees are worried about a lot, and affordability of healthcare and flexibility of benefits definitely on their minds.
Then how are each of your organizations positioned on affordability, and maybe what do you see as your role in addressing this? Maybe Trevor, if you want to take that one first.
Sure. Thanks for the question. At a macro level, we just see from the research how much waste there is in spending in U.S. healthcare. We spend about twice as much per capita as any other industrialized country, maybe with the exception of Switzerland, I think it is. But even there, we're quite a bit higher. And and when you look at the reasons for that, and there are many of them, and we all have sort of our favorite issues, I think that we see as driving that higher cost of healthcare, but we really need to be addressing all of those multifactorial issues, because that in this time of rising general inflation, which hasn't yet hit healthcare, because we tend to lag in our response to general inflation, but it's coming for all of us. And we're seeing that it happen in provider recontracting. So it's going to put pressure on, and maybe many of our attendees here are starting to feel that today. It's putting pressure on employer finances, because at the same time, the workforce is demanding higher wages, and so every dollar we spend on healthcare is a dollar we can't spend on other business, organizational, or personal priorities. So at Surest, we really feel a strong sense of mission around driving affordability for our employer customers, as well as for and maybe even more importantly, for the end consumer. And so designing a benefit that removes some of the more financially regressive levers like deductibles, that we see as better able to meet the needs of an economically diverse workforce, is one of the ways that we've done that. And one of the really powerful stories that we just heard during this latest annual enrollment cycle, that many of us are live in our annual enrollment today. One of our employers who has employees in a lot of rural pockets nationally, very diverse workforce geographically, economically, and a lot of lower paid employees as well. We found that actually by offering a Surest plan at a lower payroll contribution, they were able to bring in hundreds of people who had never previously been able to afford enrolling in benefits. They had been uninsured by the employer plan in the past, and now because we're able to offer an overall more affordable benefit to the employer, they could lower contributions, bring more people into the plan, and give people affordable access to coverage. So that's the kind of anecdote that really speaks to the kind of mission-driven organization that we're trying to bring solutions into the market for.
And Stacy as well, how about you and your team at Medtronic?
Yeah, thanks, Paige. So, and Trevor kind of alluded to this, like many organizations, we are challenged to maintain competitive benefits while aligning with internal cost pressures and budget, and trying to do all of that without shifting or limiting our shift of cost to employees or diluting access to quality care. So we do this in a number of ways, including being early adopters of innovative solutions. And one of those solutions that we have adopted is Surest. And as Trevor kind of mentioned, it's a different way of looking at health insurance. It's a digital first plan where employees can get the care that they need from the doctor or the hospital that they choose. But how much they pay for it varies based on value. And so the best part for our employees is they can see how much the care that they need will cost before they receive it. And there's no deductible that they need to meet before that coverage starts to kick in. So this has really been a game changer from an affordability standpoint. We can keep those premiums reasonable. Employees and families can comfortably get the care that they need without worrying as much about the financial impact. And we've found that if you make it really easy for people to see their options and the exact cost for those options up front, they choose the care that fits their needs while avoiding as much of a financial surprise. We're seeing that members are spending over 40% less with Surest out of pocket than they do with our other plans. Another program related to affordability is our partnership with RX Saving Solutions, which helps employees and Medtronic save money on prescription costs through education on alternative forms of medication, for example, so tablets versus capsules, or even where to fill prescriptions for the lowest cost. We've talked a lot about the cost piece, but I just want to mention quickly the access as well. We launched Included Health, which provides personalized navigation for LGBTQ plus affirming care and one-on-one advocates for their ongoing needs. And we've also implemented on-demand mental health support through Ginger. So really doing a lot both to address both affordability and the access.
How important is it to align your health benefits with the company's overall mission and strategy? And how can that make a difference in addressing affordability and other inequities? Kate, maybe I don't know what you're hearing with clients on this topic.
Yeah, I might take that question with respect to aligning to the company's overall mission and maybe business strategy. So I think that that's something that sometimes gets lost when we think about benefits. I think oftentimes benefits is viewed within the broader leadership of the organization as a cost center, as opposed to a place where the company should be making investments. And so I think that the savviest of HR leaders and the savviest of benefit leaders kind of recognize the importance of HR function and benefits and how that aligns to the overall business goals. And they really play that up in the story to broader executive leadership. So I would say it's very important. And I think our kind of most successful clients from a benefit leadership perspective really do work hard to align with their broader benefits business strategy.
Sure. And for Trevor and Stacy, I mean, maybe how are you thinking about that from your perspectives?
Sure. So at Medtronic, everything we do is in service to our mission to contribute to human welfare by creating products that alleviate pain, restore health, and extend life. You'll be hard pressed to find a Medtronic employee that can't repeat that to you right off the top of their heads. And in fact, tenet 5 of our mission is to recognize the personal worth of all employees. And so for us, it makes it easier to align our benefits back to that mission to make sure that we're maximizing physical, emotional, and financial health for our employees. So an important part of our strategy is the concept of value-based healthcare. And at its core, value-based healthcare is about accountability, right? Better patient outcomes result in better economic value. We apply the same concept of value to our health benefits, and we want our employees to have easy access to high quality, affordable care that delivers the highest possible value to them and keeps them healthy or gets them back to health more quickly. And to do that, we need partners that also promote that use of high quality, affordable care.
Yeah, I think that's a really important point, that helping people get easy information about where they can access high value care within all of an employer's solutions, spanning the whether it's the medical benefit and other programs that you make available to them, but having that ability to identify, for whatever condition I'm going through, or the service, procedure, treatment I'm seeking, where can I go within those employer benefits to get high quality, low cost care, and how do you actually make that information easily accessible to people? That's what people are looking for today. All of us probably on this panel, certainly, and attendees spend much of our time thinking about benefits and healthcare, and most people don't want to spend their time doing that. So making it really easy, clear, and accessible is super important, because people will otherwise give up, and they'll default into what the easiest thing is for them to do, and that could be getting sort of swept down an inefficient referral path or an inefficient treatment path, that's not the best right thing for them. So, so I think making it easy, clear, and accessible is super important.
Trevor and Stacy have given us some examples of this already, but maybe they can dig a bit more into it. How can employers be thinking about ways to redesign benefits that addresses this affordability and equitable access question? Are there solutions that you're seeing work now in the market?
Yeah, so I've talked quite a bit about the affordability piece already with things we've implemented like Surest and partners like RX Saving Solutions. But we're also seeing really great things happening on the accessibility side as well. We've expanded access to the progressive plans like Surest and Blue High Performance, so that everyone at Medtronic has access to a progressive plan as well as a PPO or a consumer health plan. And we're also constantly monitoring the vast point solution landscape and evaluating what might be a good fit for our employees. And, you know, like many other companies, we're focused on ensuring that access to care is inclusive and equitable. And so we've recently launched Included Health for our Black community, where a care coordinator helps find culturally competent doctors and networks. So just an example of some of the things that we're doing to ensure the accessibility piece in addition to the affordability.
I think we're seeing that. In fact, I think it may be also in Kate's Mercer study that she was referencing. We're seeing for the first time in recent memory, maybe in my working career, that average deductibles are coming down, and I think there's a recognition and some of the research on higher deductible plans is starting to show that they're maybe not serving the needs of all participants equally, and so they can be really great for people who can afford to put money away in an HSA, but many people can't, and I think those pressures, again, in a time of higher inflation, those pressures are accelerating on the workforce. And so there's a recognition that we're seeing adverse impacts from high deductible plans on rates of access to preventive care services, and the challenge is that most people, when presented with that high deductible, can't always distinguish between the high value care that they should still get and the lower value care that maybe they can defer or avoid or find another solution for. And so that blunt instrument of the high deductible is actually dissuading people from all sorts of care. And so one of the things that we're seeing this trend really accelerate of employers either adding in a first dollar coverage option to their plan portfolio, maybe replacing a legacy PPO plan with a first dollar coverage plan like Surest that can help people find high value care, but is also able to be offered at a net lower cost because people are using different treatments, providers, and finding that value in the network. So that's I think that's a really significant trend that we're seeing. Although the effect is slight, that we're just seeing a slight downturn in the average deductible that employers are offering in their PPO plans and high deductible plans. It is notable that even as inflation increases, people are more and more looking for alternatives to the past 20 years has been, I'm going to raise deductibles, raise out of pockets, raise contributions, and narrow the network. And that's not working well for a lot of people.
You know, Kate, from Medtronic's perspective, or not Medtronic, I apologize, from Mercer's perspective, you're working with multiple clients in the employer space. How are they thinking about this?
Yeah, definitely not representing Medtronic's perspective on that.
Yeah, no, don't listen to me.
Yeah, but from Mercer's perspective, so I want to echo a lot of what Trevor and Stacy already mentioned. As Trevor just noted, right, a lot of employers are looking at offering a low or no cost plan. And some of our other research has shown that most employers for 2023, about 70%, are planning to absorb any cost increases for this upcoming plan year. And it's really only a small group that are considering raising premiums and changing their cost sharing mechanisms like copays and out-of-pocket maximums. Only about 25% of employers are considering doing some of those actions. And that data came from a 10-minute survey that we just conducted, I think, in September. So again, pretty recent data. We've got a pretty good sense that most employers are not going to cost shift for the upcoming year. So what are they going to do, right? So I think the biggest area of targeted interest for employers to harness some of those cost savings is similar to what Stacey mentioned. There's a lot of interest in taking action in the pharmacy benefit. And that's followed pretty closely by implemented targeted programming. Also, like Stacey mentioned, so you're like a great living example at Medtronic, Stacey. But that's another area for sure that employers are thinking about, right? Like, where can we sort of put in specific point solutions that can help folks with specific conditions and get better management of those? I think part of the reason that employers are really focusing on those types of cost containment levers as opposed to either cutting benefits or shifting to employees, it's probably inspired by this still competitive labor market that we're in. And I think despite warnings of maybe an impending economic downturn, whatever that looks like, a lot of employees and prospective employees, they still have the leverage right now to be choosy among employers. And I think employers recognize that. And even if we do see a downturn, I'm not sure the labor market will kind of turn down with it. So, I don't have a crystal ball. We'll see what happens there. But I think that a lot of employers are trying to kind of walk a very fine line there. And Stacey would be interested in your comments there maybe. But there's also the point that I think a lot of employees got used to a really strong level of support from their employers in response to the COVID pandemic. And there's no pulling that back, right? Like, employee expectations are what they are. They're not just going to magically revert to pre-pandemic status. And I think employers are kind of having to respond to that. So that's kind of what our research shows. Like, that's where employers are focused on. But a couple of other points that I just wanted to throw in there, and maybe this will prompt some discussion. I think a lot of employers are interested in the potential virtual care offerings and where can those address the access, the affordability, the quality issues that we've kind of touched around today. So that's definitely an area employers are looking at. And then another one that, we haven't directly gotten to, I think, in our conversation yet, but it ties back to sort of the health equity theme of this series. And that's employers looking at programs and policies that address social drivers of health. So food insecurity, transportation, Wi-Fi access, right? All of those things are actually related to health. And we are seeing some progressive employers examining those as levers to pull to address some of the health equity challenges within their current benefit design.
I think that's actually a great segue to a question we just got from our audience. So I may kick it back to you, Kate, first, just to talk about broader kind of strategic perspective on this. I mean, how are employers kind of evaluating the effectiveness of these point solutions or digital health tools when they're thinking about what to include in their benefits?
Yeah, so I think there's a couple of ways that employers can think about it. The first and most obvious is the financial impact of those programs. So, and I see Stacey nodding, right? Like, ROI or value on investment, VOI, are pretty important to most employers. So that's, I think, the obvious one. I think where point solutions can demonstrate clinical outcomes, that's another area of significant interest for employers, right? They want to make sure that what they're investing in is not only saving money, but it's actually leading to better health outcomes for their people. So that's a pretty important one. And then, this one is maybe not as common, but I think is becoming more common. And that's related to some of the research that I shared from sort of what is the employee's perspective. I think there's more of a subjective value from the employees. Like, do they see these benefits? Do they value them? Even if there's not hard dollars associated with them, or maybe not clinical metrics associated with them, like, how do your people actually feel about these point solutions that you're putting in place? And that's kind of an emerging area that we're seeing from employers. They're conducting analyses to really ask their people, like, what value do you derive out of this? Is it positive or negative, and how does it stack up relative to other benefit programs? So that's maybe another way to analyze those types of point solutions that I think is less common today, but is pretty important in terms of making sure you get value out of this program.
And if Trevor or Stacy want to jump in, that's cool. If not, we'll move on to the next thing.
I'd just say I think one of the challenges that employers sometimes face in the evaluation of point solutions is pressure to get immediate financial ROI, and that can, in the case of many point solutions value propositions, that can be somewhere between difficult to impossible to prove out. And so I think gaining that institutional support behind the purpose of the program and what you're actually trying to achieve in that VOI perspective, in especially non-financial or leading indicators, can be really important because some of these are investments in the health of the population that may take years to play out. And one of the other things that I think employers are faced with is there's so many point solutions out there, and they're all knocking on your doors. They're all trying to get a share of your attention, and they're trying to get a share of the members' attention once they're in place. And if they're not integrated, well integrated into a cohesive benefits program that again makes them easy to find at the point of someone's need for that service, it's not going to work well. And so I think employers are more and more looking for how they can bring together all of those, the awareness about the right solution at the time of need into a sort of single point of access.
Yeah, that's a great point, Trevor. The benefits landscape is challenging enough for our employees. And then you bring in these various point solutions that, provide great benefits, but finding out about them, right, or understanding how it applies to a particular situation has been really challenging for our employees. And from the employer side of things, our challenge has been, how do we make sure that we are communicating in an effective way so that employees understand what's available to them and can take advantage of it, so that we can see those improved outcomes and see that return on the investment. So,
kind of in a similar vein, sorry, go ahead.
Sorry. I wanted to add on to what Stacy mentioned and just share an example, I think, of maybe a more innovative way to communicate. It's not more innovative than Medtronic, but just something I've seen in the market that I think is effective. And that's doing benefit communication tailored to specific life events that happen across the course of an employee's life. So, obviously we all engage with our benefits on our annual enrollment basis, and that's kind of when it's top of mind, like Trevor said, right? Like that's when you focus on it and you don't really come back to it until you need it. But the approach around life events gives an opportunity to remind people that, like, yeah, you've had this big life change, but there's also all these benefits that you maybe didn't think about or didn't know about because they didn't apply to you previously, but now here they are. And it's really a time from a behavioral timeline perspective where you can implement some change in behavior of your people.
We have another audience question that's kind of in the vein of this point solutions topic. And then I do want to definitely circle back to the communication and outreach that Kate was just talking about. So maybe, Kate, you could start us off again here. As employees are thinking about some of these point solutions or new options, what should they be looking for maybe when looking at early stage companies or startups that are really kind of coming to market?
Was that employees or employers?
Employers. Yeah.
Okay. Okay. So first, I'll say that I think employers should be looking at companies that are new to market or new to the employer space. And I think that a lot of employers should really take a lesson from the speed and the agility that we all showed during COVID, right? So as the COVID pandemic unfolded, I think there was, rightfully so, a lot of panic within most benefit organizations to try and figure out how do you restructure things to make them accessible now that we're in this virtual only world. And immediately, employers tried new things that they otherwise probably never would have done, right? And I think that we should continue that momentum. Like, employers should continue to pilot and continue to try things and continue to be, again, just very agile in how they think about their benefit programs and what they roll out. So that's the first thing. It's like, I think that employers should be looking continuously at things that are new to the market. Even if it seems a little bit risky, it's at least worth considering. Could you run a pilot? Could you learn something from this? Could you, derive greater value for your people from something like this? So that's something that, I really feel like employers should be doing that. In terms of evaluating them, I think to Trevor's comment earlier, right, there may not be immediate financial return, and there may not even be immediate clinical indications that something is going to work. And so sometimes I think it's hard for employers to almost like suspend that disbelief that this will ever work in order to give something a chance. So I think recognizing that sort of these new startups or disruptors that are coming to market, they're not going to have the full infrastructure to give you the financial analysis or projection, and they're not going to have the, matched control studies that would allow you to feel confident that they've published in a medical journal about their clinical outcomes. So I think you do have to have like a slightly different assessment level, if you will, for those that are new, and give them a benefit of the doubt. And again, be willing to pilot and to work with them.
Awesome. So, Kate, you just mentioned kind of maybe thinking a little differently about communicating with members over benefits. So, a significant challenge in this area is health literacy, and navigating the wealth of data around healthcare costs poses a huge barrier for many workers and other enrollees. How can employers maybe be thinking about education around benefits to kind of tackle this? I don't know if maybe Stacy, you want to jump in first.
Sorry, was that to me, Paige? On the education piece?
Mm-hmm. Yeah, go ahead. Sorry.
So I think it really goes back to the communication part, and we continue to try to debunk some of the myths, right, that come around, that come with, if we talk specifically maybe about the progressive plans, like Surest. So, one of the myths we hear is it's only for healthy people, right? Not necessarily the case. And, we know in theory, this all sounds good, but how does it really translate to terms of financial impact for both employees and for Medtronic? So it kind of tags along with what Kate and Trevor were talking about in terms of the giving it time for the results to be shown, right? And so we do have some results, and so we've engaged a third party to help us conduct a multi-year study that evaluates the impact of our overall health plan experience of people who've migrated to Surest from our other plans. And the study showed that we have been able to share in cost savings with our employees and provide a plan that's significantly richer than our traditional plans. And our families that are using Surest are spending 40 to 50% less than the comparison group of our legacy plans. And so to drive that point home a little bit more, the average out-of-pocket cost for our members in 2021 was $414, which is about half of the national average. And so we continue to see statistically significant reductions in emergency room utilization and increased use of preventative care. And so that, I think there's an education component that comes along with that in the results that we're seeing. And of course, Medtronic has saved along with this as well. And that same study tells us that after we adjust for demographic and health risk of the population, that's enrolled, our Surest plan outperformed the estimated cost of our traditional plans by about 11%. And so we're seeing savings both for employees and for Medtronic. But for all the progress that we have made, we know that there's still so much more to do and so much farther to go.
And, maybe from Surest's perspective, Trevor, how are you thinking about this?
Yeah, the communication and meeting people where they are on health literacy, because people, the health literacy of the average American is not that high. Again, we in this room, we all spend a lot of time thinking about these topics. Not everyone does, and so the communication strategy that you develop around your benefits package, and obviously we all think about that at annual enrollment time, but really throughout the year, and having those campaigns that reinforce to people how they can get the most out of their benefits. And then again, I think a lot of it comes back to just giving people easy tools to use, right? How do we consume information about other aspects of our lives as consumers? Well, more and more, many of us are going to an app, and we're accessing that information on demand at the point of need. So I think more and more we're seeing, and certainly at Surest, we've taken a very sort of digital first approach, but at the same time recognizing that not everyone is there, and so we need multiple modalities to educate and communicate with people, make sure they can answer their questions easily and effectively about whether it's how the medical plan works, or how their claim is going to be paid, what their costs are, or where they can find value in the benefits package. I think another aspect of communications is, especially for those organizations that are instituting more significant change, we've seen the institutional leadership support and reinforcing that message and its connection to business priorities can be really powerful. That can be a function of the business too, and how much do people listen to, or how attuned are they to the messages of certain leaders in the company. But that can be hearing it outside of HR can be another really important tactic that we see some employers using.
And at Mercer, how are you thinking about this when you're working with employers, Kate?
I think Stacey and Trevor covered this ground pretty well, but one thing that I didn't hear mentioned that I think is an effective mechanism with respect to communication is understanding the role that sort of the direct manager plays in disseminating the information about benefits to their teams. And so I think that's another effective way that teams can get the word out about different benefit programs, is to really have a manager strategy, make sure that they deeply understand what the benefits are and how they can be accessed and what's appropriate for which groups. And then basically using them as a rollout channel is another thing that I think savvy employers are doing.
And Kate, you've outlined a little bit already some of the strategies that you and Mercer are providing to employers when they're thinking about ways to address affordability and access. But maybe what are you hearing from clients about the steps that they're actually taking? And are you feeling there's maybe any sort of disconnect between what they're doing and what the advice that they're being given?
Yeah, I actually don't think there is in this case. I think that we're seeing from most employers the recognition that employees have these affordability concerns. There's this looming inflation. They need to figure out how to manage the costs within their plans. And most employers that we work with are inspired to take action and try to figure it out. So I actually don't think there's much of a disconnect today, Paige. At Mercer, we kind of call that a say-do gap, right? Like employers are saying one thing, but they may or may not actually be doing it. I think employers are very motivated right now and are taking action on these issues. In addition to some of the things that we've already discussed in terms of levers that employers are pulling. One thing just to call out, and I think I may have touched on it, and Trevor, you touched on it as well, is there's definitely interest in incenting the use of high quality, high value care, usually through high performance networks, different plan designs, centers of excellence, affordable care, accountable care organizations, right? All of the sort of high value care strategies are a big area right now of interest for employers that I don't know that we specifically called out, Paige, but just wanted to throw that out there as well.
And Trevor, I know you've touched on this as well a little bit, kind of the strategy from Surest around designing benefits to address affordability. Could you give us a little more detail on some of the results and maybe wins that you're seeing?
Yeah, absolutely. And I think just reflecting on Kate's comments too, I think one of the things that employers are struggling with on the affordability topic is affordability for whom, right? And do I need to achieve certain financial targets within my benefits program this year? What does that mean for my members, my employees, my workforce, and their families? And I think really important is to look for those win-wins where you can achieve better affordability for all stakeholders, and that means driving waste out of the healthcare system. That 30% excess cost that we're all bearing as Americans. We're looking for ways to reduce the waste in healthcare, and when you do that, when you lower the total cost of care, you can accrue those benefits both to the employer and the employees. And so the way to do that is avoid unnecessary surgeries, get people to those high value, high quality, more efficient doctors, hospitals, ASCs in the system. And so some of the results that we've seen from the particular approach we've taken to designing benefits at Surest is so first of all, by removing the barrier to first dollar care, we're seeing people are accessing those preventive benefits and the really important upfront, top of the chain, high value services that everyone should be receiving. But we're also seeing that just by making people aware of their care alternatives when presented with an acute situation. So could virtual care be right for you? Could urgent care be right for you? Rather than just go to the ER, right? So we're seeing lower rates of use of ER, lower rates of use of the sort of superfluous or more discretionary ER visits. And we're seeing those shift to other sites of care. And we're seeing a 10 times higher rate of use of virtual care, which is super important and can actually, I think Kate mentioned it earlier, that can be an important tactic to increasing not only affordability, but access and equity across a population. Now, there's a little caveat there too. If there's a digital divide in the workforce, you need to be careful about how you promote and ensure that everyone has equitable access to those virtual care solutions. So that's also really important. We're also seeing in terms of the evidence across our book, we're seeing that our members are shifting from instead of getting a surgical procedure at an inpatient hospital, they're having different conversations with their care professionals about could I have that done outpatient instead? Don't keep me overnight. And by the way, that's going to save the plan maybe tens of thousands of dollars. It saves the member in a well-constructed benefit design as well. Or what about the ASC? What about the ambulatory surgical center that's set up to really be focused on these types of procedures? Could they do it more efficiently and more effectively? Or even better, could I avoid that potentially low value back surgery and do physical therapy or access a program through a point solution perhaps that the employer is offering that might better restore me to health and have lower risk of complications and other health side effects. So we're seeing that sort of cascade that when you present people with better, clearer information, they're doing the things that we've all been talking about in terms of site of care shift and going to the high quality providers just by making it the easy thing to do. People will do the easiest thing. I won't say people are lazy, but we're often looking for the path of least resistance. So make the right thing to do the path of least resistance, and the outcomes will follow. What we see in terms of our total cost of care then is in the match control studies we've done that are sort of the best controlled way to look at how the program is performing for our population. We're seeing a 15% or greater reduction in the total cost of care. And so that's flowing through to lower costs for employers. But the reason we're getting those results is because members are behaving differently. They're using different treatments and they're accessing them at different providers. And that's reducing members' out-of-pocket costs. Stacey, as you mentioned, Medtronic's seen 40 to 50% lower out-of-pocket costs. That's really about 50%, 40 to 50% lower out-of-pocket costs is very consistent with what we see across our entire book when we benchmark to national outcomes. So with a really targeted benefit design, one of the other important levers that's available to us is making treatments less costly that might have more of an impact on underserved populations. So we've taken a look at where those underserved populations are in our membership, what conditions they're experiencing, and then lowering copays for things like cardiac rehab therapy, dialysis, and especially when you go to the high performing centers in the network, making sure that people can access that at really low cost. Another great example tied back, Kate, to what you were talking about with social determinants of health, and some of those are really upstream from the medical benefit, and super important to understand how those can be attacked from the employer perspective. But that can result in communities that have higher rates of asthma and respiratory issues. So within our benefit, we lower the copays for services used to treat those sorts of issues that can be the effect of disparate social determinants of health issues.
We've touched on virtual care a couple of times, but we might as well talk a little bit more about it. And so maybe Kate can jump in first and talk from the kind of 30,000-foot strategy view, and then maybe Trevor and Stacey, if either of you'd like to hop in as well. And how can and should employers be thinking about virtual care as a tool that they can use to tackle some of these access and affordability issues?
Yeah, so big area of focus right now for employers and for Mercer, frankly. I think the first thing to recognize about virtual care is that, first of all, it's not a panacea. It's not going to solve all the problems that an employer maybe has and they're trying to solve for their population. So that's the first caveat, is that it's a great tool, but it's not a magical tool. The other thing that I think is really important for folks to recognize about virtual care is that in and of itself, virtual care is not a strategy, right? It needs to empower and align to your strategic goals. And so I think that sometimes it gets flipped in the conversation and people get so excited about the potential for virtual care that they're looking to jam it into everything. And I think we really have to flip that conversation back to the way it should be and say, all right, employer, what are your goals that you're trying to accomplish with your benefit program? And so, for example, if affordability and health equity are things that you are trying to work on within your organization, virtual care in certain realms might be an appropriate mechanism to help you achieve those strategic goals. But virtual care for virtual care's sake is not really a strategy. It's not really worth applying it in that way. I don't know, Paige, did that answer your question? Do you want to dig in further?
Yeah,
or does somebody want to challenge me?
like Trevor was going to jump in, so.
Yeah, no, I think that's a really important perspective, and at the same time, I think there's a larger and sustained role for virtual care to play. So we also saw the sort of spike in born out of necessity virtual care use during the pandemic, which, by the way, we're still in, but so we have continued need for those services, and we prior to the pandemic, we were hearing loudly about the primary care shortage, which again, we're still in that, right? But virtual care can be a part of a systemic, one leg of a systemic solution to addressing primary care shortage and delivering care more efficiently and at the right level of intensity for the condition. So where it is appropriate, it can be much more cost effective, and by the way, not just cost effective, it can be much more convenient for people balancing work and family and all of those pressures of life that we're all dealing with. So I think the convenience and continuing to press on solutions to be more convenient and allow members to access at the time and place that's right for them is really important. But I think it can be part of or it can be well serving towards that strategy that Kate was talking about of providing more affordable, more accessible, more convenient, and easier care for a workforce.
Yeah, I'll just touch on the virtual care piece quickly. It's a tricky situation, particularly for us. We have a large contingent of employees who are manufacturing, who are maybe lower wage earners, that maybe have a cell phone, maybe don't, or don't have unlimited data. And so where virtual care is perhaps meant to provide additional accessibility, if that is not an option for someone, then it can quickly turn into somewhat of an inequity. And so that's something that we're trying to balance to make sure that it's a part of our strategy, but where it makes sense.
And we have another audience question here that I may hand off to Trevor first, and then Kate or Stacy, if either of you would like to jump in, feel free. How are you maybe thinking about designing benefits, within the conversation as we've been having for people who are digital nomads or working remote rather than in the office?
That's a great question. I do think that so it's a good segue from the last topic because virtual care can be an important part of that solution. I think another maybe tension with the solutions employers are exploring, and we touched a little bit on high performance networks earlier, and that's one of the trends I think that Mercer is seeing. But there can be equitability challenges there, especially in serving geographically dispersed workforces and those in more rural locations or the digital nomads, I think in the language of the questioner, and in particular, if you are evaluating removing choice from a network, how does that impact all of your participants? Does it produce inequitabilities in access in certain locations or for certain slices of the workforce, whether by socioeconomic status or are you creating quote unquote medical deserts, right, where you are exacerbating inequity? So I think that's I don't want to overextend that issue, but it's something important to look at if considering restricting a network. We've taken the approach that within our platform, we use a really broad PPO network that gives access to every provider who's contracted with the network, and we basically say we can assign copays to all of them. And if you use the more efficient providers within your local geography, wherever that may be, so if you're on the road, you've got access to high quality, low cost providers there, just as you do at home. So the approach we've taken is we can price against it. So we can incentivize use of the high quality providers no matter where you might be.
We're down to the last couple of minutes here. So, while we've made progress, affordability and equitable access are still huge challenges facing the healthcare industry. So I want to just ask, all three of you as we close, where do you think we go from here, and what's next in addressing these challenges? Maybe Stacy could go first.
Sure. Thanks, Paige. So, as I've mentioned today, we are seeing results with our strategy. We know that it's working. We're on the right path. But as I mentioned, we know that there's so much more to do as well. And so we're really taking a look at what are the things that are continuing to drive issues of unaffordability and access. And so for this next year, mental health, continues to be a focus for many organizations, but we're looking to address that for all ages and stages of life, right? It doesn't just magically hit one phase of someone's life. And then we're also looking at access and cost of care for things like cancer and musculoskeletal, right? I'm sure nothing that many other organizations aren't looking at, but is something that we haven't dove into, and so that's going to be the next thing that we look to tackle.
Sure, Kate, go ahead.
So I think, where do we go from here? I think we need to recognize that it requires relentless and ongoing focus. It's not enough to be satisfied with the progress that we make in one plan year or one open enrollment season. So I think that as an industry group, we need to continue to constantly be pushing forward on health equity and trying to advance affordability. And to the comment earlier, affordability for who? Well, affordability for everybody. And again, like I mentioned, pretty much every employer demonstrated just incredible agility and responsiveness and creativity in the face of the pandemic, which, Trevor, you're right, is still ongoing, but we're in a different phase now. But I would just really encourage employers to harness some of that same energy to tackle these challenges of affordability and equity as well.
Trevor, close us out.
I know we're at time, so I'll be brief. But what Kate said about just maintaining that relentless focus and attention on these issues is really important. These are big structural problems, and they're not going to be solved in one cycle. So let's all keep working together to make sure that we're delivering value for all the stakeholders in between the employer, the employees, and continuing to lower the cost of care and make high quality, valuable care accessible to all.
Great. Well, thank you so much to our panelists for sharing their insights with us today, and thank you to everyone who tuned in. Bye-bye.
Thank you to Paige and all of our speakers. Please visit our website at hlth.com to catch up on all Health Go Live webinars. And join us in Las Vegas, November 13th through 16th for Health 2022.